You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, wow, I cannot believe it's nearly December. Another year has just flown by. Online Pet Health members, this is what you have to look forward to in December's learning. In our Hydro platform, we have pain, the fourth vital sign. And the lecturer is going to be talking about the merits of adding pain scale protocols to our assessment. On our small animal platform, patella luxation in the canine patient, and then the inner cannabinoid system, what its role in health and diseases and how we can help with rehab. And then our equine platform, we've got two wonderful lectures: equine water treadmill exercise, research findings and clinical relevance, and lunging safely for rehabilitation. Now, these are available as recordings and are added to our extensive library of learning. We have over 90 hours now on our hydrotherapy platform, over 190 hours in small animals, and over 120 hours of equine learning. Now, if you're interested in what's in our library, go and check out the library preview on the website. Alternatively, you can reach out to us and request a membership walk around. Today, I'm going to chat with Ansi van der Walt about the building blocks of successful rehabilitation. Ansi has been an animal physiotherapist for 22 years. She's based in Johannesburg here in South Africa. She has her own practice called PetFit Physiotherapy and Canine Fitness. And many of you will recognize her name and her voice as a lecturer for the Online Pet Health membership. She is lecturing actually the December lecture, Patella Luxation. Now, success looks different for everyone. So we discuss the factors that affect our success and what we can do to make sure we are consistent with our outcomes and results. Before we head over to my chat with Ansi, a quick word from our sponsors. Choosing the right therapy laser and PMF systems for your practice are big decisions. And that's why Response System has been helping to make that decision easier for over 35 years by offering both Class 3B and Class 4 lasers, as well as a full line of PMF products designed for both small animals and horses. All of their systems are fully rechargeable and adapted for international grids. You can find out more at responsesystem.com. So, I think you guys are really going to enjoy this chat with Ansi. Let's go and have a listen. Hey, Ansi, thank you so much for joining me.
Hey, Megan, it's exciting to be here as always. Thank you so much for inviting me.
Yeah, I can't remember how many times you've been on. Can you remember how many times you've been on the podcast? A few.
I think the podcast itself only once, maybe twice. And then there's all the things.
Lots and lots of lectures that we've done. I've got a list of the lectures that you've done. And there are 7 lectures that you've done that are on our platform. 7 amazing lectures.
So this feels like my second home. It's brilliant.
It is. Yeah, you're always with us. We love it. Ansi, for those that don't know you, won't you tell them about yourself and a little bit about your practice, please?
Sure. Thanks, Megan. I am Ansi van der Walt. I qualified as a physiotherapist in, 2001. And since then, I have been working in animal practice. So I've been running my animal physio practice for, 20 years now. And yeah, I've got a private practice in Johannesburg. I'd see mostly small animals, so dogs, some cats, some hamsters, some rats, nice variety of pets. And then here and there, I do still manage to see some of my special horse patients as well. So yeah, keeping busy.
I love the rats. So you see, like the little ones. Yeah, I used to always get scared with those. I remember once I had a little hedgehog. So I didn't know what it was, just the box, they come with the box and then you're like, what is inside? And then you open up and it's a hedgehog. And I was like, oh my gosh, what am I going to do? But it actually came for a little leg brace. So I made a little leg brace for it, yeah. So I could at least breathe. I know, it was so cute. They're very cute. Yeah, very cute. So Ansi, today we're going to be chatting about how we can have successful rehabilitation and have consistent positive outcomes. Before we touch on that, I think I want to chat about what is success. So, because I think that really differs depending on the patients that we have and depending on the clients that we have. So in your view, how do we look at what is success depending on our patient and our client?
Megan, that is such a great question. Thank you for asking that. And I agree with you 100%. It is very dependent on the patient and also very dependent on the person who is looking for the help. The person has come to ask for help, and that is the caregiver, usually the owner of the animal, whichever animal it might be. And the expectation that that person has of what a successful outcome is might be very different from what your picture might be in your head. And I would say the definition of success is to meet the client in the middle somewhere, to really understand what it is that they're hoping to get out of it, what they want to see for their pet, and finding a way of meeting those expectations, or at least if that's not possible, having conversations about it to find a place where you can meet in the middle.
Yeah, I mean, I think also if we look at the patient, for example, we could have a top performing agility dog compared to a companion at home that just needs to go around the block. So what's what we need for the one, we don't necessarily need for the other. And we have to take that into account when we're thinking about our rehab programs. And I must say, for me, when I think about it, we just want the best outcome that we can get. It doesn't matter whether that dog doesn't need to jump over jumps. We want it to be the best that it can, but we always are needing to manage those clients' expectations. And, for those of you that are Onlinepethealth members, you would have hopefully listened to the managing the catastrophizing clients, which Ansi lectured on a few months ago. And if you haven't, you need to go and listen to that lecture, because it is so, so important. Managing our clients' expectations and dealing with clients is a big part of what we do. So thank you for that. So yeah, I mean, I think we need to really look at what patient we're dealing with, and then tie it in obviously to the client.
And I also think perhaps equally important is just keeping an eye on our own expectations and whether that is really appropriate for this particular client. We have this idea in our head of what a perfect outcome would be or could be, and maybe that's not really what the client wants, or necessarily what would be the best for that dog. We tend to be people who love spending a lot of time with our animals and doing a lot of training and all sorts of things. And some people just really want a pet and a companion that's happy lying on the couch. And as long as it's not so lying on the couch, everybody's quite happy. We might have a completely different vision about a perfect outcome for that pet. But ultimately, success is determined by the person who sought the help, who came to you for a solution.
Exactly. And I think that we also, there's a big part that we play in also making sure that whatever their outcome they want is a realistic outcome. So we're often the last hope, and we need to be realistic. And I think sometimes we also want the incredible, to happen. And we are those positive type of people. But I think, being realistic is also important.
Yeah, no, for sure. Expectation management is the foundation for success, let's say.
Yeah. So when we're looking at getting these consistent positive outcomes, what do you think is necessary in order for us to do that?
I would say that the most important starting point is to have a really clear plan right from the start. And you can't have a clear plan if you don't have a really good evaluation. And a plan is something that can be flexible, that can change, that can be updated. But if you start without a plan, then you're already not setting anybody up for success. So I would say right from the beginning, you need to get a clear sense of what it is that needs to change for this patient for them to get the best outcome. And along with that, who is part of this plan? It's not just you and the dog, or you and the hedgehog, or you and the horse. And there's a lot of people involved here. There are other caregivers in the home, like the domestic worker who looks after the dog the whole day. And there's kids in the house, and there's maybe the grooms at the stable yards. Who is all part of this plan that needs to be managed? And the more you have an understanding of who needs to be involved and who needs to be on the same page, the better.
Yeah. And it could also obviously also involve more people in the vet rehab team. I mean, other professionals might actually sometimes be involved.
No,
So yeah, a lot of people. So let's dive deeper into that evaluation. So what do we need to do to create that, that foundation of that perfect or great evaluation?
That evaluation is such an interesting thing, because I think it is partly skill, about 50% skill, and it's about 50% art, because I don't think you can have a really good evaluation without building a strong foundation of trust, both with your patient and also with the client. Both of them need to trust you, because trust makes sure that you can get a clear idea of what's going on. I mean, we've all had the dogs that come in and they're all tense, or they either won't stand still or sit still, or they're trying to eat us up, or they are just rigid and petrified. You cannot get any information out of that. And quite often the clients are equally uncertain about what to expect and unsure about who you are and what you can bring to the party. So for me, it's really important to spend a lot of time just getting everybody at ease, building that trust. And if it takes you a little bit longer to get to the answers that you're looking for in terms of the evaluation, I think that's an investment worth making. And part of that, and I think almost the most critical thing that we can tend to leave out, is to really, really listen. We're the experts, we have the training, we have the experience, and we're very good at telling people what we think should happen or what we think is wrong. And they've been told a lot of things about what is wrong. But do we listen enough? What are the actual challenges that they are experiencing? How do they understand what's going on with their dog? The vet may have said to them, this is torn, or that is injured, or your dog has arthritis and it's incurable and your dog will never be able to go for walks again. What did they take from that? What is their understanding? Because the understanding that they come into your evaluation with can set the tone for the whole process. And if they picked up some stompy somewhere, for those who are not from South Africa, stompy is like a little snippet of information that's not complete or accurate necessarily. Then they already have some negative expectations potentially. And that's really bad for building trust and building like a positive environment to move forward with. So I think unless you are willing to really, really listen and ask lots of questions and spend the time building that relationship and building that trust with both the client and the dog, you won't be able to get a really good evaluation. So that would be my absolute foundation for a great evaluation.
Yeah, I love that. Can I just say something about the listening? Because one of the things you said is that maybe there's something that they believe, right, to be true that maybe isn't. Something they've got some impact, they got it wrong. And if you think about it, when we are dealing with our clients, they've got a problem, and we are trying to solve that problem, right? Mm-hmm. And so if we're not listening to the problems that they have, then we're not able to solve their problems. And so they might have a problem that we haven't listened to. We're just assuming what we're assuming because we're talking and doing what we're doing and not actually listening to them. And then their perception of the outcome is not going to be good because we haven't addressed their problems. So I love that. Listen to what they are having to say. Find out what their problems are, and then we can easily address them. And some of them might be a whole lot easier to address because it could be a false belief or something that they think is true that isn't really. So great advice.
Often it is just that, exactly like you say, a false belief, something that they heard somewhere or read somewhere, and they just took on some incorrect information. And sometimes it's really easy to correct that. And then other times it's a little bit harder, and there's a lot of re-education that needs to happen, about negative beliefs around arthritis or, pinched nerves, or, people come with all sort of things that they believe mean something that doesn't necessarily mean very much. So yeah, definitely ask more questions and listen more. Yeah, and that will give you a better sense of what their exact challenges are, and sometimes it's easy. Some clients talk easily, some clients are very open to share and communicate. And some clients you actually need to, as a therapist, work a little bit harder to get the information that you need to be able to help them better. And then I would say my next thing is always look at the whole dog. It's very easy to be sidetracked by the obvious problem area, especially if the dog comes with whatever the patient is that we see, comes with a preset diagnosis. So this dog had a cruciate ligament repair or cruciate op of some sort. So we have in our head that this is the problem area. But dogs aren't only a knee. They're a whole body with a whole history and other things that have happened before, and compensatory movement patterns and bad movement habits. So I'm personally very systematic about my evaluations, and every dog always gets fully assessed from the cervical spine to the tail, front limbs, hind limbs. And for me, it helps to have a really, really systematic approach so that I know I don't accidentally leave something out. And even if you have a lot of experience, it's very easy to miss things if your approach isn't very consistent. And definitely if you're just starting out and you're very new to this, having a good system and a very structured approach can give you a lot of confidence that you're not going to accidentally miss things that could make a big difference to your treatment plan. So it's always a whole dog, definitely.
Yeah, so you mentioned obviously looking at the whole dog. Are there any other mistakes that you think that vet rehabbers make when they're doing their evaluation? I mean, especially thinking of new grads, because it takes you a while to get set in your ways. You think, I'll do this, and then that doesn't quite work. And then eventually, once you've been consulting for a while, you just have your system and it works.
I think the biggest trap, especially if you're starting out, is to be, let's call it sidetracked by a diagnosis. So a diagnosis is quite a helpful thing to have, but it's only one piece of the puzzle. And I often see it. I mean, we're very lucky, thanks to companies like Onlinepethealth, to have wonderful resources where we can post questions and, get advice from other professionals. Which is a really great resource to have. But I often see people asking questions before they've even seen the patient, purely based on a diagnosis that they received that they will be, in theory, seeing this patient for. And I think it's very important to take on board the diagnosis that the dog's been given and have it just as one puzzle piece and not be overly influenced by it. So diagnosis is important and can give us information about how far in the healing process it is, which is really important for things that need to heal, like a fracture repair or a ligament rupture or a tendon rupture. But it stops you from really approaching the whole dog again in an objective, systematic way, because in your head, a diagnosis comes with a certain pattern and a certain picture, and you can get overly focused on that instead of really paying attention to what is the functional challenge that this patient in front of me today is struggling with. Because if you look at 10 cruciates or 10 femur head and neck excisions, they're all going to respond differently. They're all going to present differently. And they're going to have different priorities that you need to address first. So always just look at your patient first. What is your particular patient struggling with from a functional point of view? Which building blocks need to be in place at this stage of their healing? And the diagnosis is just one little block in that puzzle piece.
Yeah, I think you're so right. I mean, I can think of 2 examples of cases that I've seen. And I think one of the things we have to remember is that when we get the referral, right, there's often a time frame between that time that vet last saw the patient and we see the patient. So anything could have happened in between there. So that's why, yes, you have that diagnosis, but you have to look at the whole dog. And two cases that just as you were talking now came to mind is a dog that was referred to me once for a patellar luxation that ended up having a cruciate rupture at the same time when I eventually saw it. And you're nodding your head, I'm sure you've seen that often, that happens. And another case that actually was referred to me for paralysis and hind limb paralysis that actually had bilateral cruciate ruptures.
Shame.
Yeah. And sometimes, it might be a mistake on someone's part. Maybe they evaluated the animal. There might be concurrent things happening. So there could be neurological deficits with cruciate ruptures, and or something's happened, the dog's fallen, ruptures, cruciates in between the time the vet saw. So all these things can happen at any time. So we need to just be constantly reevaluating our patients and making sure, like you say, we see the whole dog. So yeah, great advice. Thank you, Ansi.
No, absolutely. I agree with that. And it's definitely not about questioning the diagnosis as much as it is about just going into your evaluation with an open mind and seeing what you're seeing with the dog in front of you or the horse in front of you or the cat in front of you, rather than thinking, for cruciates we do this, for hips we do this, for elbows we do this, and just going in with a holistic approach from the beginning.
Yeah, exactly. So our next step after doing our evaluations would obviously be creating our treatment plan. So let's dive into that a little bit.
So for me, I would say that the most important thing is to prioritize. So if you've done a really good evaluation, you have a nice clear picture in your head about the challenges that your patient is dealing with. And it can be tempting to want to, cure the world for that patient and fix everything. And the reality is you can't do that. Yeah, there's only so much you can do, especially with the complex cases, especially with the ones where they're really chronic and you've got layer upon layer of things that have been going on. It's important to try and narrow down what would make the biggest difference for this patient in the next week. Next week, we can look again, but for this week, what's going to make the biggest difference? Is it going to be to get a little bit better hip mobility? Is it going to be primarily pain relief? Is it going to be to just get maybe a little bit more controlled activity for, say, a dog that's been on a lot of crate rest? Is the priority at this point to just get some healthy, regular, some leash walks going? What is the priority for now that you can focus on? And I set myself no more than 3 priorities per treatment session. So that would be a treatment and then what I want the client to do until they come back and see me. Anything more than 3, the client's overwhelmed, nothing is going to happen. They're going to forget all of it if you give them too much. And then you also don't really know what it is that you did that really worked. So you want to pick the really, really key things that you think are going to make the biggest difference. Focus on that. And then next time, if that's much better, you focus on something else. And in that way, you can really, really see how much of a difference is happening in response to your treatment. And the client's got a clear idea of what's actually going on with the dog. And they feel more motivated to stay on board with the home advice that you've given. I mean, I've seen clients receive home advice and home exercises for the next week that is 4 pages long. And they just look at it and they go, well, I can't do this. So then they do nothing. So really, really focus. And to be able to focus, you need to have a lot of clarity about what you think are the main things that are going to help your patient.
Yeah, I think also communicating to clients with like goals to really work well for me. So I used to say like, these are our goals and this is what we're going to do to achieve each of those. And that really used to help me with my communication with them. And I think also for myself, if you create the goals and then you prioritize them. So you might have overarching goals basically for the patient as a whole, but per treat, every time you treat them, and like, this is what I'm going to do. So prioritizing those goals is so important, because like you say, otherwise you get overwhelmed. You're like, well, I could do all of these now, then what do I do? So the prioritizing part, that's great advice.
And what I liked about what you said there is being really explicit about your communication. We forget how much we know, because we work with it every day, and things that are clear to us not necessarily clear to the people that we're talking to. And that could be the dog's owner, or it could even be the vet that referred the dog to us. That we need to be really explicit, like you say, about the goals, and say, okay, so this week we're going to work on getting a little bit better hip extension range, and we're going to just try and get more consistent weight bearing on that leg. So in order to do that, we're going to focus on these two things for now, and then next week we'll see what that is like. But I think you absolutely hit the nail on the head with really explicit communication. How clear were you before that client walked out of your door and got in their car and left? Are you all on the same page? So that is absolutely critical.
Just reminded me of something actually that was in my consult, my client form that they used to fill in. And I used to actually ask them, what is it you're hoping to achieve by coming to see me? Like, what would be, like, what's your wish for your dog? And that's a great question to ask, because then it actually sets the tone for actually what you need to achieve. And then, you can always go back to that. Say, like, this was what you wanted. And then when we're looking at, if they're thinking, is this treatment being successful, then if you've achieved that, it doesn't mean you can't change it and say we want more after that. But then you've got sort of what they want. You remind them of, this is what you hope for. This is where we are now. I do think we can improve more. We could do this. So yeah, just finding out from them exactly what they want, then it helps to be able to communicate further, because then you're consistently just reminding them of what the outcome we're actually hoping for.
And that gives you a really, really nice framework for every time you talk to them and you are demonstrating things that you're doing with the dog, then you can go, well, remember how you said how it's important for you to get Fido to climb up onto the couch again. So now look, what we're doing here is we're allowing him to shift more weight onto that leg. So we're going to get him to be able to flex that hip enough so that he can bring it up. So now you see how we're working on improving that range of motion. And then you can contextualize it for them so that they can relate it to the outcome that they were hoping to get. So that is a very valuable thing to ask them right in the beginning, definitely.
So anything more about the treatment plan that you want to chat about before we chat about the mistakes that people make?
Well, I think it's just really important to understand that when you create a treatment plan, you need to become part of that person's support system, because a treatment plan is not something that is static and that's a once off. And for your treatment plan to be successful, the person needs to know that you're there for them. And one of the most valuable things that I've found is having a really, really consistent follow-up strategy. So sending, and most systems can automate this, send a message the day after to say, how is your dog? So that if things didn't go quite as you'd hoped, and maybe the dog isn't that much better, or there is some post-treatment soreness, which incidentally is something that's very important to warn people about. I'll talk to that just now about when we talk about mistakes, is just to be there for them. If they're unsure and uncertain and they're seeing things and they don't know if it should be like that or not, they need to know that they can reach out and discuss this with you. Because if you have just left people with, say, some home exercises, it's going badly, they're not getting it right, then they feel very, very disempowered, and they often feel like, oh, well, this obviously isn't going to work. I can't do this. My dog is worse today. And they've got no way of feeling that it's okay to check in with you. So I'm really, really consistent about my post-treatment follow-ups, and I found that has made a huge, huge difference. just to set people's mind at ease and go, that's okay. There's nothing unusual about that. Do a hot back, just back off the exercise a little bit, and you're still perfectly on track. So you have to be a support system for your client.
Yeah, love it. So are we going on to mistakes?
Well, just as I was saying that, I was thinking that, it's we learned that in human physio is warn people, especially after the first time, your first evaluation, that there might be some soreness the next day. And this is especially true when you spend a lot of time doing a full assessment. So you may have taken joints into ranges where they haven't been for a while. You've asked the dogs to do some physical activities that may not yet be comfortable. And they might be quite fatigued. Dogs that aren't used to going a lot of places in the car might be a little bit stressed. It was a new environment. So often the next day they can be a little bit more uncomfortable. And also if you up their treatments a little bit, or you've upped their exercise program in practice a little bit, regardless of what that might have been. So you've, started them on hydro, or you've increased their underwater treadmill duration or sets. Just understanding that having some post-exercise soreness is not necessarily something to be stressed about. And you have to warn them that this is possible. Obviously, we try and avoid it, but sometimes it's going to happen. And it doesn't mean it's a regression of the condition. It's like when you haven't been to gym for ages and you go to gym, you feel it the next day. We know that's okay. We know all you need to do is just carry on moving and it'll settle. Clients need to understand the same thing. It's going to be okay. This is what you need to look out for if there's something to be worried about. So just also prepare your clients for when things might not match what their expectations might have been. So just that goes further into building that trusting relationship, making a connection with them, that they know you're there to support them.
Yeah, because the last thing we want them to do is to feel like the dogs got worse, or your patient's worse, and then they just don't come back. So, it's all about us letting them know this is what can happen and it's okay. So yeah, preparing them for that.
Very important.
One of the other things that I think of, and this has actually come up a lot when I'm chatting to vet rehabbers about, they'll see a patient and then they don't see them again. So they'll see them once, and that might be one of the reasons, that you haven't warned them about some discomfort that they might have, in the 24 hours after you first seen them. But another time that I see this happen is when the vet rehabber doesn't give a clear treatment plan, and to say, I'm going to see the dog. I'd like to see the dog twice a week for the next 2 weeks, and then we're going to reevaluate. So they just sort of treat the dog and then leave it up to the owners to decide when they should treat them again. And they might say, like, I'd like to see them again. And then the owner will say, well, should I just book an appointment? And they'll say yes, and they're not very clear as to what you actually want. And I think a defined sort of time frame, and it doesn't mean like you have to say let's say in your mind, you've got a treatment plan over 12 weeks. You don't have to give them the whole 2 weeks, 12 weeks. Just break it down into 2 weeks or 1 week or whatever. Say, I used to say 2 weeks. 2 weeks, see your patient twice a week for the next 2 weeks. This is what I'd like to do, depending on what I find on each treatment. And then we'll do a reevaluation and take it from there, I think that when they have a time frame in mind, the clients, they can conceptualize it. They're like, okay, this is what we're going to do. And then they will go and make the appointments. But if you don't tell them, they're not going to make the appointment, because you're just leaving it up to them. And often I think vet rehabbers do this because they maybe not confident enough in their treatment plans, confident enough in themselves, and they feel bad because they don't want the owner to spend the money. But I think it boils down eventually to their confidence levels.
No, for sure. And I think we all made that mistake when we started out, and you go like, oh, do you want to book an appointment? Let me know. And What I do now is I actually work in 6-week cycles, and I found that works really well. What I say to the client is that most structures in the body take at least 6 weeks to change meaningfully. If you think of a muscle strengthening or a tendon healing, kind of is 4 to 6 weeks for real meaningful change to happen there. And what the plan looks like in that 6 weeks may be very variable. So it might be in these 6 weeks, I want to start off by seeing your pet twice a week, or it might even just be, I'm going to give you an exercise program, but in 6 weeks' time, I want to see your dog for a reassessment. So that helps the client also feel that there is a plan. It's not just a sort of open-ended, nebulous idea of maybe the dog will be better, maybe the dog won't. But it also, like you say, creates that expectation of there's going to be a structure to this. We need to have follow-up so that we can monitor how the treatment plan is working and stay on top of it. And I really don't find anybody really concerned by that. If you're confident about it and you go, look, it's going to take 6 weeks to change. This is going to be the plan that I recommend in those 6 weeks. What day is best for you?
Yeah, exactly. But be blunt.
Yeah, exactly. You have to make those decisions for them, because otherwise they're going to take the animal home and go, is it better? Maybe it'll get better. Maybe I can wait a little bit. And meanwhile, there really are things that needed to be addressed on a more consistent basis. You knew that, but you didn't take ownership of those decisions.
Yeah. They're looking for someone to take control. That's actually what they want, because for them, it's so overwhelming. They don't know what to do. They just want their dog to get better. So when they have that person who is like, this is what you need to do, and this is the days that I'm available, which appointment do you want? You're taking control. And when you take control, that gives them more confidence in you, because you're like, you're owning it. But when you're airy-fairy, they start to lose confidence in you. They're thinking, well, why is she so shifty? Why isn't she committing? Is she not committing? And what's going on? So they start to question things.
Absolutely. They came to you for guidance. And if you're not providing that guidance, then you're not giving them a lot of reason to trust you as well. So that's really, I think everybody just really needs to get confident about taking charge of the structure of the treatment plan.
So what else can we say about the treatment plans and mistakes maybe, or things that we should be doing?
Well, I don't think it's a mistake so much, but just, I spoke a lot about having a really clear plan, but at the same time, that plan needs to be very adaptable. And that for me is exactly the value of following up and saying, how is it going? You might give a client some really basic exercises. So, get your dog to crawl under the coffee table, and they just don't get it right. And by following up, and if it doesn't work, okay, what other plan can we make? If the dog won't follow treats, can you come up with a client with some other way of getting a similar effect in a creative way that the dog will actually do? Because a home exercise program is great if it happens. And if it doesn't happen, it's not going to achieve very much. So being there and being able to get really good at adapting things, think creatively and finding other ways to do it. Not everybody's dogs are trained. Cats are always really fun to get home exercises done with. You have to be super creative with them. And if you don't know what's working or not working, you can't come up with a different solution. So just have a clear plan. And it's almost like that principle of the better you know the rules, the more effectively you can break them. The more clear your plan is, the easier it will be for you to go, okay, but I still know what I want to achieve. There must be another way to get to that if this is not working. So both within your session at the practice while you're doing your treatment or your therapeutic exercise intervention during the dog session, and with what's happening at home. You need to be able to have a lot of different approaches to achieve the same result.
Love it. One of the things, chatting about like having a successful outcome, often in our rehab cases, there is no finite, well, there are sometimes, but often not a finite finish to rehab, right? We're like, this is your date and that's it. We don't see you again. Sometimes when we have post-operative cases, this might be the case. But the majority of times, we're going to be treating that patient for extended periods and maybe seeing them on a regular basis for the rest of their life. How do you communicate this in the beginning? Because I think that is sometimes one of the false beliefs that pet owners have, is that they think their dog has been diagnosed with a condition, maybe it's had an operation, but it's 8 years old and it's had a cruciate and it comes to you and it's actually got spondylosis and it's also got hip dysplasia, and you find all these other things. And then, there is this not finite finish to your treatment, and you need to then say to them, well, this is how we're going to do the maintenance. So how do you approach those kind of cases? Is this something that you say from the very beginning? So when you first seen them, say, this is what we're going to do, we might need to do maintenance treatments on a regular basis? Or is it something that you approach after you've addressed the first issue and, say, listen, when we first consulted, I did find some other issues and these are ongoing problems?
For me, it's very dependent on the case. And I think the important thing there is right in the beginning to start asking those questions about what the client's understanding of the condition is. And as you're doing the assessment, start to talk about things like degenerative joint disease, so osteoarthritis. Usually when we talk to our clients, this would be the term that we use. What is it? How does it work? It's not curable, but we can definitely manage it very effectively by doing the correct things. And then I do tend to prefer to start with the short term. Okay, so for these next 6 weeks, what are we going to focus on? We want to see if we can improve some muscle mass. We want to see if we can improve range of motion. And we want to functionally see if we can get the dog to be, climbing the stairs again, or, getting onto the bed again, maybe with a modification of little steps, whatever the case might be. And then we go, okay, so that's amazing. Maybe after 2 or 3 6-week lots where you've achieved all those goals, you go, okay, this is really good. This is probably as good as we're going to get your dog. But just remember that this is not something that is going to go away. It is progressive. We will need to stay on top of that. I highly recommend that we just come back once a month. Let's just keep an eye on it and make sure we keep Fluffy as comfortable as possible. And a lot of people are really happy with that, and they feel that in that way they don't need to get too worried about whether they're not missing pain. It's quite interesting. I find that there's a lot of people who come and say, I don't know if my dog's in pain. I don't know if he's sore. And, I do quite a lot of education about the kind of things you can look for, but they then feel that it's being looked after and it's being checked, and they're not going to allow their dog to suffer unnecessarily just because they didn't notice.
Yeah.
So if it's something definitely more acute, so say it is a straightforward cruciate on a 3-year-old border collie, I would not have those kind of conversations. But if it is your 9-year-old Labrador with a history of hip dysplasia and elbow dysplasia, that's now had a cruciate, then we start to have those conversations early on.
Yeah, so that they're aware that, this is not a short-term thing, it's a long-term thing. And I think sometimes even just by saying that it's going to be long-term, they feel like you're going to be along with them on this journey and you're helping them. So Ansi, let's chat about when things go wrong. So let's say when you don't get the outcome, how do you handle these situations? Have you got a system or process in order to deal with them and to try and work out, because I think that what we have to do is when things don't go the way we want them to, is try and work out where the problem was so that we don't repeat either the same mistakes that we've made, or find a way in which we can in future change the outcome so we get, obviously that's what we're talking about now, consistently positive outcomes.
Absolutely. So, and I think the first place to start is to just acknowledge and accept that we aim for consistent outcomes. Obviously, this year Online Pet Health is all about excellence. and we do want to be the best we can possibly be, and we want that for our patients. But the reality is we're not going to win them all. There are going to be cases that really just don't do well. And I would say point number one is giving yourself a little bit of slack about it, and not expecting yourself to be perfect. And once you can accept that you're human and life's not perfect, then you can start to troubleshoot more effectively. And for me, the best way to look at it when things don't go quite how I expect them to is, in fact, using two different models. So the first thing is that understanding that a patient doesn't exist in a vacuum. Your dog, your cat, the horse, they all function in an environment. And much as though we are seeing them for their physical challenge, we also have to understand that whatever physical problems they come to us with has occurred in a particular environment and with a certain set of behaviors. So often when things go wrong, it may well be because you have I'm going to use the example of a dog again, that is super over aroused and very anxious. And, it's summer in Joburg and there's thunderstorms every afternoon, and the dog is constantly panicking and scrambling to get under the bed, for example. Those are all things that actually aren't directly in your control. And as a vet rehabber, you can't necessarily change the environment. You can't replace the client's house tiles, porcelain tiles with carpet. You can't change the dog that has severe anxiety problems. But point number one, if you're running into some roadblocks and lack of progress, would be to go back and check all of these elements. So physically, you may be addressing everything at this point, but what is it about the environment that you haven't asked about? What is it about the environment that you can have a conversation with the client about and say, what's happening with the other dogs in the house? What's happening when you're not there? What's happening every time the doorbell rings? And what do we need to adjust about this? And the behavior. What are the things that might be causing excessive stress in the dog's life? We cannot ever, we'd like to, because it keeps life a lot simpler, but we can never dissociate the physical from the behavioral, ever. If there is a dog that's in constant high levels of stress and anxiety, their ability to regulate their cortisol in their body, their oxytocin in their body is really, really low. There needs to be things to be done to just regulate their whole neurobiology at home as well on a daily basis. Otherwise, especially with your chronic pain patients, it is not going to change. Right. So point number one is, have you looked at all of these domains? It's outside of our comfort zone sometimes as a vet rehabber to go, venture into behavioral questions, venture into really asking, what is the house like? And I don't want to mention stairs too much, because I think for me, there's too much emphasis placed on stairs, and dogs can't go upstairs and dogs can't go downstairs, which in some cases is true, but there's other things, that we really need to ask. When do you mostly notice that your dog is sore? What happened today? What does your dog's daily routine sort of look like? Is it more sore towards the end of the day? And then what did that day look like? So it kind of does come back to asking a huge amount more questions, especially if things aren't going right, and think, what is the one thing I haven't asked about that might not be about what I'm seeing in front of me? Because you're seeing that patient, if you're lucky, 40 minutes once a week. There is 24 hours in a day, every other day of the week that's happening, that you're not there to see what is happening then. So we need to get better about asking those sort of questions. So that's the first thing. Have you asked about the environment and about behavior? In terms of the physical things, when that doesn't go right, again, that could be very variable. So if it is a post-surgical patient, we know there's a lot of potential complications with surgery. There could be infected plates. There could be just things that didn't go quite right in the surgery. I'm just thinking about the femur head excisions, which I always tell clients it's probably the least stressful orthopedic surgery you can see. The dogs recover well, they don't need as much restriction as the others. And every now and then you see the femur head excision that really doesn't do very well. And often those just didn't really go right. And there's a little bit of a bony spur that needs to go back and needs to be revised. So maintain those open channels of communication with the surgeon so that if it's not going the way you think it should compared to others that you've seen, can you talk to the surgeon about it? Go, do you want to see this dog again? Because I'm not sure it's going the way it should. Okay. So definitely maintaining those channels of communication so that you can ask these questions. And sometimes it might just be a matter of going, we need slightly stronger pain medication just for a little while so we can get the patient over this little hump as we introduce a little bit more movement. Okay, so yeah, I would say communication, because there might also be, like you said earlier, comorbidities that may not have been fully addressed or assessed or even possibly completely missed. You might need to review your priorities. You started off with the idea that maybe what this dog really needs is better shoulder range of motion. And then you go, well, maybe that's not the biggest thing holding this patient back. Maybe the biggest priority at the moment is getting a little bit more motor control and a little bit more stability so that when they are loading the limb and weight bearing on the limb, they do it with healthier biomechanics. So reevaluate your priorities and see if you could focus on something slightly different and if that gets you a better result. So yeah, that's generally my starting point. If I see my expectations here don't seem to be matching with what I'm seeing with the patient.
Yeah, those are great. So I wrote them down so we could just go over them again. So the first one is look at all the things that are out of your control, potentially in the environment. The second one is to look at the behavior and just ask more questions. So what is the one thing that I haven't discussed? So that's what you ask the owner. Is the one thing, like in the time that you don't see them, is there something maybe that you haven't mentioned to me? If it's a post-operative case, then is there a potential that there is a possible complication, because that could happen? Are there any comorbidities that potentially are causing problems? And then go back to your goals and have a look and see maybe you've prioritized wrong. And I'd like to add one more to your list. And that one is double check your communication with the clients and make sure that what they understand, what you need from them, that they are actually doing. So like things that I think about are exercise. What they interpret of what you've said is exactly what you think that they're doing. So sometimes they might be doing more than you think that they're doing and they didn't quite understand it. Sometimes they might not be doing what you hope that they're doing. So for example, when you think that they're doing certain exercises and lead walking, and they're not doing exactly that. So when there's been some form of miscommunication between you and the clients, you think this should be working, right? That miscommunication has caused a problem, and that's setting the patient back.
No, absolutely. We had one just on Saturday, which is a TPLO 4 weeks post-op that hasn't been created. And it's the first time I saw the dog, and you assume that the client understands the importance of these things. And I actually had to explain, it's like a fracture, it needs to knit. You don't want that plate to come loose. So you also assume that by the time you see the patient, the client has had a certain basic understanding of what was required. And that is not always true.
So our lesson is don't make assumptions of what the client knows. And also, I think sometimes a lot of these vet clinics are really, really busy. They're discharging patients and they might have thought that vet nurse told the client this. And so we assume, because you've had a client from that vet referred, that this is what they tell them. something might have gone wrong. They could have had a problem with the discharge and they couldn't have maybe didn't get all the information. So always communicating and asking them, like, is this what you're doing? Or did you get clear post-operative, treatment plans? And do you know what you're supposed to be doing? Asking all those questions. So
absolutely. And I do think it's one of our big strengths is that we do spend more time with the client. And that really puts us in a very valuable position of being that person who can have that better scope of communication with the client.
Definitely. And we build our relationships are different because we have that time, Absolutely. And we are that support for them. So that's one of the things I love about vet rehab is the relationships that we have with our clients, very different to normal veterinary.
It's very different and it's very valuable and special.
It is very rewarding. Ansi, thank you so much. Like always, you always have so much amazing stuff to share. And I think the vet rehabbers have really, really learned from this. And I think, especially our newly graduated vet rehabbers, these are things that if you set into place right from the beginning, can really change the way that you practice and can help you, because a lot of these things that Ansi and I are sharing now are things that we just learned over the years, I'm really, really grateful, Ansi, that you've come on and joined me so that we can have this conversation to help all the vet rehabbers out there. So hope you guys enjoyed this one.
Megan, it's been lots of fun as always. Thank you so much.
Have a great day, Ansi. Take care.
Bye.
Bye. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. For more information about continuing education for vet rehab therapists, you can go to Onlinepethealth.com. I'd like to thank you for listening to this podcast and of course thank our sponsors, Response System. They are as passionate about therapy lasers and PEMF equipment as you are about veterinary rehabilitation. They would love to answer any questions you have, so please feel free to reach out to them at responsesystems.com or you can email lisa@responsesystems.com.